Imagine going in for a routine surgery, trusting that our doctors will do everything to help you recover, only to wake up with unexpected complication. Surgical error can leave lasting damage, and in some cases, they can completely alter a personal life. But how do these errors happen, and what can you do if you are a victim? In this video, we will dive into surgical errors, why they why they occur, and types of mistakes that can happen, and most importantly, what your legal rights are if you have been affected. In this video, we will cover the following topics: what qualify as a surgical errors, common type of surgical error and their impact on patient, how surgical error happen, negligence, miscommunication and more, the medical and emotional consequences of surgical errors, legal rights for surgical error victim, what are your options, a step to take if you believe you have been affected by a surgical error, how to pursue compensation and hold the responsible party accountable. By the end of this video, you will have to a clear understanding of what constitute a surgical error and the step to take if you or a loved one is a victim. Let's start by defining surgical errors. A surgical error refers to any mistake made during the performance of a surgical procedure, which can harm the patient or leading to unexpected complication. This error can be caused by a variety of factors, including human errors, lack of communication, improper equipment, or a failure to follow proper medical protocols. Surgical errors can occur in any type of surgery, from minor procedures to major surgeries, and they can happen at any stage before, during, or after the operation. While surgery is always associated with risk, an error that results in harm is not something a patient should have to endure. There are several types of surgical errors that can occur during a procedure. Let's go over the most common ones. First is wrong side surgery. One of the most well-known surgery errors is performing surgery on the wrong side or side of the body. For example, a surgeon may operate on the wrong limbs, organs, or even the wrong patient. This kind of error can cause significant harm, including permanent disability or death. Anesthesia error. Anesthesia error can occur when the anesthesiologist administrator too much or too little anesthesia. Too much anesthesia can lead to a patient's heart stopping, while too little can cause the patient to regain consequences during surgery, leading to a terrifying and dangerous experience. Surgical instrument error. Sometimes surgical instruments are mistakenly left inside a patient's body after surgery. This can result in infections, internal bleeding, and the need for additional surgeries to remove the foreign object. Fourth is nerve damage. Surgeon may accidentally damage nerves during surgery, which can lead to numbness, weakness, and in some cases, permanent paralysis. This is a common problem in surgeries involving the spine or limbs. Fifth is infection or contamination. Poor hygienic, improper sterilization of instrument, or failure to follow proper surgical procedure can lead to infections. Post surgery infection can be life threatening and require extended hospital stay, prolonged treatment, and even additional surgeries. 6 is failure to monitor patient's visual sign. During surgery, doctor must continuously monitor a patient's visual sign, such as heart rate, blood pressure, and oxygen level. A failure to do so can lead to a range of issues. for a strong to heart attack and can even result in death. Sometimes complications arise during surgery that require immediate actions. A surgeon's failure to address this issue promptly can cause lasting harm to the patient, including organ damage, blood clot, or infections. Now, let's explore how surgical error occur. Well, there are many factors that contribute to surgical mistakes. Some of the most common reason includes: first is human errors. Surgeons, anesthesiologists, and medical staff are human, and mistake can happen. Second is miscommunication. A lack of communication between the surgical team is one of the most common cause of errors. Third is fatigue and overworks. Surgeons and medical staff often work long hours, which can lead to fatigue. Fatigue can impair judgment, slow reaction time, and lead to mistakes during surgery. Fourth is improper equipment or technology failures. Sometimes errors occur due to malfunctioning equipment or the incorrect use of surgical instrument. And fifth is inadequate pre-surgery preparation. If a patient's medical history is not thoroughly received or pre-surgery instructions are not followed. Now, let's talk about the impact of surgery errors. The consequence can be both physical and emotional for the patients. First is physical consequence: infection, chronology, pain, and permanent disability are common outcomes of surgery errors. Second is emotional impact. Patients who suffered from surgical errors often experience feeling of anxiety, depression, and frustration. Third is financial consequences. Surgical errors can result in additional medical expenses, loss of income, and an overall financial burden. Victim of surgical errors can may have legal recourse to seek compensation for their injuries. Here are what you need to know about your legal rights. First is medical malpractice lawsuits. If a surgeon's error was the result of negligence, you may have the rights to file a medical malpractice lawsuit. Second is a statute of limitation. Every state has a statute of limitation for medical malpractice claim, meaning you must file your lawsuit within a specific time frame after the error occurred. Third is expert testimony. In medical malpractice cases, expert testimony from other medical professionals may be required to establish whether the surgical error was due to negligence or if it was a known risk of the procedure. Fourth is compensation for pain and suffering. Victim of surgical error can seek compensation not only for medical expenses but also for pain and suffering. If you believe you have been the victim of a surgical errors, here are the steps you should take. First is seek a second opinion. It is important to consult with another medical professional to confirm whether your injuries or complication was caused by a surgical error. Second is document everything. Keep detailed record of our medical treatment, surgeries, and any complication that across as a result of the surgery. Third is consult with a medical malpractice attorney. Speak with a lawyer who specialize in medical malpractice. They can assess your case, help you understand your legal option, and guide you through the process of filing a claim. Fourth is file a formal complaint. If necessary, you may file a formal complaint with the hospital or medical boards to investigate the error. Surgical errors are not just mistakes, they are potentially life threatening events. If you have been affected by a surgical error, it is important to know that you have legal rights and options for seeking compensation. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more insights into medical law. If you have experienced a surgical errors, don't hesitate to reach out to a qualified attorney who can help guide you through the next step. Remember, surgical errors should not be something you face alone. There is ha- help available to get you the compensation and care you deserve.